I am Mathieu Loposso from Democratic Republic of Congo. I am in Kinshasa University Hospital. I present my abstract, Data de Heat. Factor contributing to recurrent obstetric fistula post-surgical repairs among women. Our hypothesis is to determine factor involved in the recurrence of obstetric fistula post-surgical repairs. This is a cross-sectional study which took place from October 1 to 31, 2019, using a sample of 62 women with obstetric fistula. Patients were interviewed using questionnaire. Additional data were obtained from patient registers, from outpatient consultation, emergency department, as well as obstetric records and any other hospital register in Tsisa. We used the interview to supplement socio-demographic and clinical data. The physical examination included gynecological and urological assessment. For the classification, we used case-weighted classification. Data were recorded using Microsoft Excel 2013 software and analyzed with SPSS 22. Continuous data were summarized using means and standard deviation, whilst categorical data were presented as proportion by means and table or figure. Student test was performed to assess difference between two means. Either T-score test with and without trend or Fisher-Exa test was used to test the degree of association of categorical data. The factors associated with the recurrence of obstetric fistula were obtained using logistic regression models. Unadjusted odds ratio were initially calculated to screen for inclusion in multivariate models, while multivariate odds ratio were computed after adjusting for confounding univariate factor with a p-value of less than 0.005, considered as significant. Our results. The mean age of the patient was 31 years, range 20 to 34 years. The majority of patients came from area located at 60 km, 61.2% in average, while 25% of women residing in area located at less than 30 km to the hospital. The majority of participants, 48%, were multiples. Labor duration exceeded 64 hours for 65% of women. The majority of fistula, 45%, were of type 1 according to case-weighted classification. Less than 65% of the patients had a small fistula, less than 2 cm. The predominant location was trigonal, 35%. Age greater than 35 years, with P 0.012. Obstetric fistula greater than 2 cm, P 0.001. Vaginal septum, P 007, and fibrosis, P 0.008, were respectively 3.5-fold, 3-fold, 4-fold, and 4.6-fold, also likely to be associated with the recurrence of obstetric fistula, leading to multiple surgical repairs. Other risk factors included labor duration greater than 6 hours, hysterectomia, and type 2 fistula were associated with recurrence. Interpretation of our results. Recurrence of obstetric fistula leading to multiple surgical repair were found to occur in other women who developed type 2 fistula whose labor period was prolonged. Fibrosis developed post-surgical was also a major risk factor for subsequent surgical repair. Hysterectomia was also seen to be frequently associated with fistula with complicated initial repair, as leading to subsequent surgical procedure. Concluding message. Labor duration should be monitored. Precaution must be taken to avoid complex fistula and post-surgical development of fibrosis. Hysterectomia should be performed with precaution to prevent the recurrence of fistula during this surgical procedure. Thank you.